Hello and welcome to Oakville Matters. We've been in COVID territory now. We declared an emergency 8 weeks ago, Monday, March 23rd. So 56 days we've endured together, and maybe this is day 57. So with me today to talk about what matters in Oakville with COVID around us is Natalia Lischina, who is the town councilor for the northeast part of Oakville. Natalia, how are you today?
I'm well, Mr. Mayor. Thank you for having me back.
Now, you are one of the people that I think of as most committed to daily outdoor exercise. So I'm going to combine two questions into one. Are you going out as much as you want to? And are you wearing a mask when you're outside? How are you keeping safe?
Well, you are
And are
correct.
you taking your dog with you?
I don't have a dog. That's one thing I don't have, but I know a lot of my neighbors do. So it's wonderful to see them out there walking their pets, which is great for exercise and of course for the pets as well. But yes, as you know, even prior to the pandemic, I've always been an avid outdoor exerciser. But as a healthcare practitioner, I try to practice what I preach. So when I tell my patients it's important for them to be outdoors, get fresh air, it's something that I want to make sure that I do as well. And I have to tell you, in the last, well, like you said, 8 weeks, these quarantine days, the one thing that's kept me sane for sure is actually being outdoors. I like to power walk, so I've checked out pretty much every trail we have around Northeast Oakville. And you know what's really cool is I actually see a lot of residents who are following the rules that we're asking to, which is the social distancing, in particular physical social distancing of the 6 foot. In fact, this morning, I took a power walk right along, excuse me, the neighborhood down to Bayshire Pond. And I came across a number of grandparents with their little ones, and they were very careful, and was really actually quite pleased to see teenagers walking who were doing the social distancing and being careful when I was passing them. So that's great to see. I don't actually wear a mask when I do walk outside. And one of the reasons is that up here in Northeast Oakville, there's a lot of opportunity to be able to social distance. So, and the good thing is outdoors is actually much safer than being indoors in the confined space, because even a light wind will dilute the virus. And as we know that virus load is one of the factors that we take a look at to see for infection, because you need hundreds to thousands of viral particles. So we're much safer outdoors, and the ability to social distance in our area. I do understand that there's places that that's not possible. And so I think it is important in those cases to be wearing a mask. I know that runners and joggers are actually encouraged to wear masks because of the way they're breathing. And this is the interesting point. And I know I'm going on, but people don't realize when they're talking, they're actually, the virus is coming out in their breath. And if they talk louder, it goes further. And if they sneeze, it catapults. So it's really important to make sure that when there isn't the ability to social distance, that you are wearing a mask. And I'd like to come back to that, but I'm sure we will.
So when you're running, does your exhalation travel farther than 2 meters?
Well, so actually, funny enough, you should say that the 2 meter rule is more of a safety rule. Back in the SARS days, so about 20 years ago, they found that it's about 3 feet that the virus travels in just normal conversation. But to be safe, that's the distance we have is the 6
So you double the observation
right.
in an effort to be safe.
Right. But, but the thing is, runners generally are breathing heavier. And so the air does expel, or the air is expelled with a bit more virus than everybody else if they're walking the distance away. Now, here's the thing. We're a society that's not used to mask wearing. And if you, actually, I had a look at a couple of studies, and one of them was really quite intriguing. It was the researchers from Europe and Hong Kong did 2 models. They looked at 2 models, and one of them was if 80% of the population wore a mask, so a face mask in public, versus 50% or less. and they found a huge difference with the 80% wearing. So that's 4 out of 5 people wearing a mask in public actually cut down the new rates, the growth rates of the daily cases. And this is really actually quite important for us now because we are relaxing the rules. We're starting to open up and more people are going to be in closer proximity. And, you know, to go back a little bit, you know, if we take a look at it from a population standpoint, wearing a mask in public does very little to protect you as the mask wearer, unless you're wearing an N95 mask, which are the types that our healthcare workers are wearing, but it's not something that's recommended for the general population. And of course, we don't have enough of those. But it does matter a lot if we wear the mask because we're not actually then spreading the virus as much as we normally would by talking, by coughing, and that kind of thing. So that's where it really comes down to. It's not what you could do for me, but what I can do for the community by wearing.
That's right. To borrow a phrase from Archie Bunker, who used to say, "Stifle yourself." The idea is to keep your virus to yourself. Well, you know, you're a doctor, a chiropractic. Are you still seeing patients? And that's a laying on of hands type of doctoring, isn't it?
So we actually closed the clinic during this pandemic. Chiropractors, along with many other types of practitioners, are not considered essential unless for emergency cases. The clinic that I run with the chiropractic school here in Oakville and Bronte actually has a significant population of seniors, and we know that seniors are a vulnerable population. So we decided it was actually safer not to even provide emergency care. There are others who do, but I do not at this time. We're hoping to open up soon, but again, I think safety is first priority.
So what stage are you guys in? Are you like 2 weeks away now from opening?
I'm really not sure. The province has not provided that information to us.
Yeah, okay. Well, it's a little bit like the off-leash dog runs. The province has said they're going to open it, but all of the things they open are subject to criteria, safety criteria, and they haven't provided us with their safety criteria. So we're kind of poised at the gates to open them up, waiting for the province to say, by the way, here's the rules that you have to enforce. So in case anybody was looking for that news, let me slip that in.
We have a leash-free park here in Northeast Oakville at Glen Ashton Park, and you know, we've done a lot of upgrades. We know a lot of people use it, but obviously because of the quarantine and the pandemic, it's been closed. I suspect when we do open, we'll still be making sure that people are still trying to you know, physically distance. So the benches and anything that, you know, touching surfaces are trying to be avoided altogether. And you know, and that's why I mean, a lot of people are now walking their pets, and we had to put that bylaw in to make sure that they are keeping their pets on a leash. Because a lot of that was an issue for people who were using our trails and the dogs were running loose.
Oh yeah, the leash law in Oakville is very old. It didn't just happen. And curiously, I mean, it's one of those things that Oakville is different from other places for. Oakville, and this is before you and before me, Oakville requires your cat not to run free either. I know cat owners. I might even live with a former cat owner who had trouble obeying that law, and might have been very proud when the cat brought a little bird home and laid it on the doormat of the front door. But that's,
oh goodness. Well,
bird lovers in Oakville were very horrified at the toll on the birds from cats running loose. You know, it's regrettable in a way that I buried the lead of the news of the day here into the middle of our show, but where we've gotten for 8 weeks of effort is we have the lowest death rate that you can find anywhere. It's like 15 per million in Oakville. It's about 40 in Halton overall. It's 100 and something in the province of Ontario, 120, something like that. It's 155 per million for Canada. A lot of people compare us to other places and say we should be like them. I'll just point out that the US is about 250 deaths per million. So we look pretty good compared to that. And for those of you who want to be like Sweden, they're 368 or something like some number like that, 370. So 40 times our rate. I'm not sure I want to be Swedish.
Yeah, I don't think
But
so.
where we've reached as a result of our 8 weeks of effort is we have crushed the curve, and we are opening up. We're opening up in a careful and responsible way. And while we were crushing the curve, we did that, we said, for a reason. And the reason is to build up our healthcare system's capacity so that we could handle the serious illness that can be caused by this virus. And that's been a success. You probably know from news reports that the hospital in Burlington used the time to build a field hospital in a tent outside their building.
Yes.
And what we did in Oakville was we built a field hospital inside the Oakville Trafalgar Memorial Hospital, the new one, on the unfinished floor that was added to that hospital in order to get us, the council, to make the $130 million donation that we made to the hospital because we wanted room to be able to grow if we needed it. So now we have huge capacity. We're ready to face the virus. And that is built into this idea that we're shifting now to reopen. There is a ready to face it element to this change that the government is ringing through in every province across the country. And each province is at a different stage of being ready to face it. So it's important to remember we weren't doing all this sheltering in place in order to kill the virus because we didn't think that was possible. We did it so that we could build capacity, tick mark, that's a success, and now we're ready to face it. So facing it means that there's going to be increased risk. And and so the shift is gone at the upper levels of government. This is not Oakville's decision. This is the Ontario decision. The shift is gone to from trying to protect everybody to protect the vulnerable. And so we've seen a big focus on trying to prevent further outbreaks in long-term care because we've got a lot in other parts of the province. The death toll in Halton has not been predominantly in long-term care. It has been in older people, but we used to value older people because they had learned things they could share with us. So let's not throw them under the bus too soon here. And the result is that we have a situation where in order to control your risk, I think you need to remember what I'm calling the 3 C's. You should avoid, if you're a person that's vulnerable or you think you're vulnerable, or you'd like to wait to have the virus, the way to delay it, the way to control your risk of having the virus is to practice these 3 C's. Avoid crowded places, avoid confined places, and avoid places where people who circulate a lot are to be found. Like the more you move around in the community, the more places you expose yourself to, the more you increase your chances to pick up the virus. And to help prevent picking it up, wash your hands all the time.
Absolutely.
You touch anything, wash your
Absolutely.
hands. So my 3 C's, and I hope that that'll keep you alive, whether whether you're afraid of the virus or not. Some of our residents are convinced that it's only a bad cold. They haven't been paying attention to some of the horrible cases and how badly this virus can go through your system.
Right.
So, Dr. Lischina, the stage 1 today is going well, I think. We have stores that aren't in shopping malls open. We've got some forms of sports, and you're our action lady on physical activity. And animal services, pet care services and all.
Yes.
What else what do you expect to go on today in the next 2 weeks as we gauge success?
Right. Well, I think it's important, as you mentioned, that we're in these stages, just as the province announced. They want to see how we all do when we open up slowly. So the cautious approach, I think, is the right one. You know, you can never, I guess, say enough the importance of everybody's own personal responsibility. You know, that being that, like you said, to not mingle in large groups, to make sure that they distance themselves. You know, I see people, neighbors talking across the street. I mean, that's pretty cool to see, because they're still able to communicate with people, not just, you know, virtually, because a lot of us are there, but even for seniors, you know, if they're outside of their home, they're still talking to neighbors across the street or a couple doors down, which is important, because mental health actually has been really affected through this whole quarantine. And that's why, you know, that's why I say when you're outdoors, it's not just for physical health, it's also for mental health. So I highly encourage that. But I did want to come back to the mask question, because actually I had questions from residents about where to get a mask. And I just wanted to actually looked up some of the places. And you've mentioned it to me before. Mona at Oak Dry Cleaners, actually in Ward 5, is I believe has stock now, and she takes that through a donation for our healthcare workers, frontline healthcare workers. Oakville resident Lindsay Woods has a store called Q Designs, and they've been her staff has been redeployed to making head coverings and face masks. We have a volunteer group on Facebook called Canada Mask, and that's organized by Eve Lynn. And so that's a place to get non-surgical masks for seniors. And of course, there is a selection of PPE on sale at convenience stores across our town. And I know in particular at the Metro Plaza here in at Upper Oakville and 8th Line. So there is that opportunity to make sure that you do get a covering for your face. And again, when I talk about that, the universal face mask wearing, you know, we're here in Canada and in Oakville, we're just not used to that. And it's going to take some time, but it's really, really important, because we have data from countries in Asia who, you know, surgical face mask wearing has been widespread for years. And really it has to be a grassroots movement. So when we can get 80% of our population to wear it, we are doing a lot for our vulnerable, for the seniors and those with comorbidities, but really also to help prevent that next wave that could potentially be coming. Now I see you've got a mask with you. Let's check it out.
Well, I'm really glad that you started off by, you know, giving a call out to Mona, because what I have is one of the first ones that Mona made, and I think it's a beautiful, stylish thing. I'm going to put it on. I'm a little worried you won't be able to hear me, because one of the side effects of a mask is it's harder to hear people. And if you're a runner, you can hear it good?
Yeah.
If you're a runner, I'm told that a mask is a little bit tough on your deep breathing that you might want to do. But this is a gorgeous little thing with kind of a wheat sheaf motif, don't you think? So I keep it with me, and I wear it whenever physical distancing is not possible.
Right.
So for example, and then there's certain places where you have to have one. Like for instance, I shop at Sobeys. They don't require one, but they space you out 2 meters apart. At Longo's, they require you to have a mask or you can't come in the store. I'm not sure what Fortino's is doing. In fact, one of our Fortino's stores has been like a hotbed of complaints about bad behavior to me for the last 8 weeks.
Well, you bring up a really good point. Even on the weekend, there's been a number of social media reports where people would go to a gardening center or a landscaping facility where, you know, outdoors is one thing, but then you are going in to pay for your purchase, and the employees aren't wearing a face covering. And you know, that should absolutely be policy for every employer in Oakville. And again, as we open up more and more, that for sure their employees need to be wearing face masks. And again, back to that 80% of our population, you know, you're not doing it for yourself directly, you're doing it for the community, and really that comes back to protecting you as well.
You know, in January, which was, and that was before I think we knew much about it, but it was sort of the middle of January, I was on a flight from Las Vegas to Toronto, And I was astonished to see that about a quarter of it was a large jet, a jumbo jet. A quarter, and it was full, and a quarter of the passengers were wearing face masks. And that was like maybe January 20th, something like that.
Mm-hmm.
So when people say we didn't know, I guess some of us knew.
Well, and you have to also think about the stigma associated with that. I mean, again, it's not the societal norm for us in Canada and in Oakville to be wearing a face mask in public. So the stigma with that is, oh, you know, you're sick or something is wrong, and that really needs to sort of leave our consciousness and think about the greater good, that we're all in this together, and we have a responsibility personally and towards our community.
And speaking of somebody who's in it with us, Oakville's possibly most loved service, the Oakville Public Library, is working on curbside pickup and return.
Yes.
So that we can get you, if not back in the library, we can get you back to the library.
For sure.
And we're also expanding our book lockers that we have been putting in places before we ever heard of COVID, where you can, you don't have to go all the way to your nearest library. You can go to a rec center or a store and pick up a book that you've ordered, or return a book that you're done with. Yeah. Or other material. Our librarians would be cross with me if I acted like books are the only thing they do. They're in the information acquisition and provision business.
Books and more, for sure. If also I could do a little shout out as well with respect to we're all in this together. There was the Oakville men's hockey team, the Beavers Hockey Club, had an initiative, a fundraising initiative for the Fair Share Food Bank of Oakville, and which resulted in a huge donation of food, protective face masks, and over $5,000 towards that initiative. So kudos, gentlemen, great job.
Yes, very well done, and everybody else. The food banks in Oakville and in the rest of Halton have been overrun by calls for help and food, and so if you have the capacity or the gentle soul necessary for it, please consider making a donation to your local food bank. It doesn't have to be food; they're perfectly happy to accept money and turn that into food.
Mm-hmm. No, we appreciate all of our residents doing everything they can.
Fair Share Food Bank, which is on the website. My wife and I, we made our donation by credit card, and that was, touchless. We didn't even have to drive there. Although we get to the point where it's a form of relief and entertainment to take a drive around town, just to get out of the house.
And great. Places like Oak Park Neighborhood Center here in Northeast Oakville, as well as film.ca cinemas. Obviously they can't be open, but they're doing so much for the community with respect to the food collection, and so which is really, really important for
now. Speaking of getting out of the house, I got a hot tip for you?
Oh.
Conservation Halton's magnificent parks are going to open later this week with a special reservation system. A reservation system. It's all electronic, so that you can go. You'll be guaranteed that you have a parking spot. It's all included in the small price of admission to our parks. And you'll also be assured that the number of people, the volume of people in the park, is such that you can keep your distance. So and if you find social distancing and physical distancing difficult phrases to use, there's this third one. You just say, keep your distance.
Keep the distance.
And the distance is
and you know what? That's
2 meters.
Well, people have asked, why have we opened the parking lots in our big parks? And that it is, the reason is because we're trying to encourage people to walk to their local parks to enjoy the fresh air and space, rather than drive to a bigger park and then, really congregate to where they shouldn't be. So that's why we're taking that cautious approach right now.
Right, but if you're a fan of Crawford Lake or Hilton Falls or Rattlesnake Point or Mount Nemo or Kelso Summit, midweek, Wednesday or Thursday, they're going to be open. You go to the Conservation Halton website and make your reservation, get your registration, and you show up. You don't have to actually exchange air with anybody. You can show your little chip through the window of your car. And actually, they have scanners that are going to let you in based on your license plate. When you register, you give them your license plate, and the license plate is recognized when you get to the gate, and boom, and you go. So, and then you pay. If you haven't paid electronically online, you pay on the way out. There you go.
That's wonderful.
A way to get outdoors.
Absolutely. Well, and the weather's starting to cooperate, so it's going to be a good thing. And again, just we've got to encourage people to get outdoors, to get fresh air, get exercise, but be responsible. Make sure that you're looking out for others. You know, that kind of reminds me. I know we've opened up the parks, and if people want to picnic with their family, which is great. But you have to make sure that you're keeping the distance from others. And you know, the worst thing is actually having confrontation, because that's actually the opposite of being safe. So you know, just if someone feels unsafe that someone's come by and they're sat too close, just to ask politely, saying that please respect the distance, because we are in this. So I think everybody in Oakville is very respectful of that. I mean, we do have couple of cases here and there, and you know, that's unfortunate, but the majority of people have been awesome. So great job, residents of Oakville.
And there's more good news if you're concerned about our hospital. The hospital is awaiting the word from the province to resume regular clinical services. They're on the cusp of that go ahead. And I want everybody to know that emergency and urgent work like cancer surgery and stuff, that had been continuing throughout the last 8 weeks. So only what people felt was safe to defer was deferred. And Halton Healthcare is looking forward to continuing to keep us safe and healthy. And we'll just close with a little reminder that we've been promised by the province that they're going to help the cities in Ontario. The province of Ontario is going to help the cities with the devastating revenue losses that we've had from recreation and transit. And we're very hopeful that that means that there will not be a COVID tax increase. And I sure hope that social media doesn't change that into there's going to be one. Thank you very much for being with us today. It's always great to know how many people care about Oakville, and I'll see you again next time.